I'm going to coach dentists to improve the profitability of their dental offices, to increase the amount of time that they can spend away from the office and enjoy their careers again.
Thank you guys so much. I really appreciate it. Great job. It's a wrap.
Hey everybody, Dr. Mark Costas here, founder of the Dental Success Institute, author of the book Pillars of Dental Success. Are you guys frustrated? Are there things in your office that just aren't getting done that you have talked about with your team over and over and over again? Do you feel like a nagging parent? If that is the case, there are a couple quick hacks that I can share with you guys that have helped me and my clients all over the world to make sure that things are getting done at the end of the day so that the practice is exactly the way that you want it to be when you get there in the morning. Okay, here it is. End of day protocol. Very, very simple. Okay, so you all have your organizational charts, right? So we know that we don't want an organizational chart to look like a pom-pom, meaning that everybody in your organization has direct access to you. Okay, so the organizational chart should look like this. You are the CEO on top. You have an office manager and maybe a personal assistant, and everybody else is underneath them in some sort of order. Okay, so the way we have it is I am on top, and then we have an office manager, and then I have a personal assistant. They deal directly with me. Everybody else goes through the chain of command in order to ask me a question. Now, come on, I know we don't want this to be, super strict where people feel like they can't approach me. I'm still friendly with my team. We talk about stuff all day long, but when it comes to certain things, if it comes to things like wanting a day off, if it comes to a discrepancy in hours, if it comes to something personal like maybe requesting certain days off in the future, or working on, refined hours because they're going back to school, something like that. That all gets handled by my office manager and their direct supervisor, okay? So I am not fielding questions all day long. I mean, we have enough work to do when we're focusing on patient care and worrying about managing the office and the finances and wearing all of our hats. We don't need to be dealing with very small, insignificant things that could be handled by their direct supervisor or the office manager, okay? So we have our pecking order. We have the organizational chart. So at the end of every day, the end of day protocol is going to be a huge godsend for you guys if things aren't happening around the office. Say, for instance, for whatever reason, the drawers aren't getting restocked, or your carts aren't getting restocked, or the toaster has crumbs in it every week, or the refrigerator is starting to smell really, really bad because people are leaving their leftovers in there all week. I know it sounds like insignificant stuff, but if it's like me, guys, those little things are pet peeves that drive me absolutely nuts. So make sure that you have some sort of end-of-day protocol with all the things that are consistently not getting done on a sheet of paper. So each individual person has an end-of-day protocol. It's basically a checklist, okay? They have to make sure that they're doing their common area protocols. For us, it's called common area protocol, and that is like cleaning out the refrigerator, vacuuming, taking out the trash. So for us, each day they have a different common area protocol. So common area protocol done, check that off. And then make sure post-op calls are done, check that off. All of their drawers that they're particularly responsible for, or their carts that they're responsible for, are restocked at the end of the day. Check that off. Make sure that all of their charting, their patient charting, is completed at the end of the day. Check that off. Whatever it is that is commonly getting missed, and in our office for a lot of days, it was the post-op calls because they get so busy, they'd forget to call the patients that we did major work on, and the post-op calls weren't getting done. We fixed that really, really easily. We had a end-of-day protocol list, checklist, check, 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 check. That goes in the box of their direct supervisor, and the direct supervisor collects, and the office manager collects all of the end-of-day protocols at the end of the day. And I also have an end-of-day protocol for the office manager, so her protocol gets put in my box at the end of the day, okay? And part of that is for her facility checklist. She wants to make sure that she goes through the entire facility before she leaves at the end of the day, or first thing in the morning before I get there, to make sure that all of those things are done. Make sure that the drawers are restocked, that the reception area looks clean, that the vacuuming was done, that the trash got taken out, that all the post-op calls were done, because we have a post-op call route slip at the end of every day. So those are the sorts of things that need to be checked off before anybody leaves at the end of the day. Your office will be perfect when you walk in the morning, and if it's not for whatever reason, and somebody put a protocol list, end of day protocol list in your box with something checked, and you notice that that wasn't done, you have a reason to discuss that with that particular team member. Okay? That's the small tip that I have for you today. I hope it helps. Get those end of day protocol lists figured out, get them printed up, get a box for each supervisor of each department, get a box in your office so that the office manager can leave her end of day protocol in your box. And that should be the first thing that you look at when you walk in the office in the beginning of every day. Have a great week. We'll talk to you next week with a new tip. Take care. Bye-bye.